The Exchange on Deep Dive.
Thank you so much for staying with us. Every second hour, we get into the exchange. And this evening, I am joined on the line by Mr. Itai Rusike. He's the Executive Director with the Community Working Group on Health, CWGH. And this evening, we talk about the fight against the spread of measles. There was an outbreak that was first recorded with the first case of measles in Mutasa District, Manicaland Province, on the 10th of August, and the disease had spread as of the 15th of August to many other provinces across the country, and cumulatively we're looking at 2,056 cases, and unfortunately 157 deaths. So it's very critical that we talk about measles, we understand what it is, what are the signs, what should you do if you suspect measles in your child, how can we prevent it, can an adult contract measles, and more importantly, how safe are the vaccines, and why is it so important that you get vaccinated? Mr. Rusike, good evening and welcome to Capi Talk.
Thank you very much, and good evening to your listeners.
Thanks so much for joining us this evening. We want to get talking about measles and breaking it down so our listeners can understand and also look out for it if it may be lurking its head within their household or homestead. So please help us understand, as a starting point, what is measles?
Yes, so I also wanted to make it very clear that I'm not a medical doctor, but I'll try and share with your listeners from the layman's understanding of measles. I am a public health activist, and I work in communities, educating communities about health literacy. And now, as a country, we are facing a challenge of measles. Maybe to start with, even though a safe and cost-effective vaccine is available for measles, unfortunately, Zimbabwe is finding itself dealing with what I can term a primitive disease or a medieval disease, a disease of the past. We don't really expect a country like Zimbabwe to be grappling with a disease, like measles. Because if you look at measles, the measles vaccine has been in use for nearly 60 years now. The vaccine is safe, effective, and inexpensive. It costs approximately just $1 to immunize a child, against measles. So maybe going back to your question, measles is a severe disease caused by a virus. It is normally passed through direct contact with an infected person, through infected air.
And what are some of the signs and symptoms of measles? How would I know that this is what I'm suffering from?
Kana zvichinzi munhu ane measles kana kuti gwirikwiti, atingati ma signs and symptoms include like hot body, rash which starts on the forehead and neck and then covers the whole body, running nose and eyes, vamwe vanoita like misodzi mumaziso nekuchururuka madziwa, red eyes, kukosora, a cough, white spots in the mouth, and in some cases vamwe vanoita diarrhea. So if not treated early, the child may develop complications akaita severe cough, pneumonia, blindness, deafness, and also malnutrition.
Yeah, those sound pretty nasty in terms of my permanent conditions there. So what should our parents do if they've picked up my signs and symptoms? What should one do if they suspect measles in a child?
Chekutanga, take the child, to the nearest health facility immediately. Ukangofungidzira kuti mwana anogona kunge aine measles kana kuti gwirikwiti sezvatambotaura. And then we also need to look at caring for a child, with measles. If the child is still breastfeeding, you should continue breastfeeding. Toramba tichikurudzira vana mai kuti nyangwe mwana akanzi ane gwirikwiti mwana yeye ngaaramba achiyamwiswa. Give the child, plenty of fluids, if not breastfeeding. If the child has diarrhea, prepare and give, salt and sugar solution. Ndinovimba vana mai vazhinji vane ruzivo kuti salt and sugar solution inopreparewa sei nekuda kwekuti tinombosangana nemadiarrheas mudzimba matiri. Give the child, nutritious food frequently and in small amounts. Clean the child's eyes with the mildly salt water every 4 months. Avoid the use of harmful herbs on the child's eyes, because vamwe vanogona kutotanga kuda kutorapa mwana ane gwirikwiti nemamwe maherbs aya tiri kushandisa anonzi alternative medicine. Saka zvinenge zvichidiscouragewa izvozvo. Give the child his or her medication as prescribed by your health worker. But zvakanyanya kukosha ndezvekuti take the child back, to the nearest health facility or health worker if their condition is deteriorating. Vana mai tinoramba tichivakurudzira kuti kana mwana waona kuti ari kuramba achidzikira ngaaendeswe kuchipatara. In terms of treatment, there is no specific, antiviral treatment that exists for the measles virus. Severe complications from measles can be reduced through, supportive care. Zvinhu zvanambolista zviya zvekuti mwana ngaaramba achiyamwiswa, ngaapiwe mafluids and so forth.
If you're just joining us, this is The Exchange, and we are talking all about measles and understanding what it is and fighting against the spread of measles against a background of a worrying 2,056 cases recorded nationwide across provinces. First cases recorded in the Manicaland province with 157 deaths. So Cabinet has actually also issued a statement on this, and there is a program of vaccination, but it becomes very important for us to have these conversations and understand exactly what it is. And we're so privileged to have Mr. Itairu Sike, who works in the public health sphere in the communities. He's the executive director of the Community Working Group on Health, and he's just explaining to us what it is, and particularly for vanamai kuti mukaona zviri kutaurwa izvi zviri kurehwa izvi, please take the child as soon as possible. Please follow the recommendations in this program and get medical attention. Mr. Risike, coming back to you, let's talk a little bit about prevention measures. How can measles be prevented?
Reganiyasotaura nechishona.
Aiwa dedemurai zvenyu.
Chinhu chikuru chatinenge tichikurudzira kunana mai vese. Ndinovimba ivo vana mai kana kuti maguardians vachikura taenda tinobaiwa nhomba kumakiriniki. Ngatirambei tichitevedzera tsika idzodzo dzekubaisawo vana vedu. Tikada kutarisa pane vana vari kuonekwa vaine gwirikwiti kana kuti measles, tiri kuona kuti vana ivavo vazhinji vacho havana kunge vakabaiwa nhomba yekudzivirira iyo measles kana kuti gwirikwiti. Saka zvinenge zvakakosha kuti vana vese ngationei kuti taenda nevana vedu kunovabaisa nhomba nokuti zviri kuonekwa kuti unvaccinated children, under 5 years are at the highest risk, of getting, measles and its complications, including death. Like you said at the beginning, so far we have lost more than 157, children. And to us, those are preventable and avoidable deaths. Vana ivavo taikwanisa kuvadzivirira kuti vasasangane nenjodzi yekurasikirwa neupenyu. Dai vana ivavo vange vachinge vakabayiwa nhomba iyoyo yekudzivirira measles. Saka mushonga mukuru sezvandareva pameasles, kubayisa vana, ngatibayisei vana. Tiri kuona kuti sezvamareva pekutanga measles yakatanga kuonekwa muna April kumutasa district kuManicaland. Asi pari zvino measles ikuratidzika kuti yapararira nzvimbo dzakawanda nemaprovinces akawanda. Zviri kukonzerwa nevamwe vedu vaya vasingatevedze tsika yekubayisa vana. Nekudaro mumagungano anga achiitika angadai ari magungano emakereke, sezvo munoziva kuti panoitika makereke vanhu vanofamba vanobva kumasvingo kuenda kuManicaland kunopinda musangano wechechi. Vamwe vobva Goromonzi kuenda kwako kuna mutasa kupi kunopinda musangano yechechi. Pavanozobva ipapo pamusangano wechechi vachinodzokera kunzvimbo dzavo, taakuspreada zvekare iyo measles yacho. Izvo zvakonzeresa iye zvino zvinawo kuti measles inge yatekeshera nzvimbo dzakanyanya. The only advantage that we still have is that schools are closed. And I'm just worried that as the schools open, the risk of further, spread of measles can also be increased. So it is important that guardians and parents should make sure that their children are vaccinated. And it has also been noted that even unvaccinated pregnant women are also at risk, of getting, measles. And any immune person who has not been vaccinated or was vaccinated but did not develop immunity can also become infected. Zvoonekwawo zvekare kuti vaya vasina kumbobvira vabayiwa nhomba yekudzivirira measles vachiri vadiki vanokwanisawo zvekare kuwanikwa vachiita se vachibatira measles nyangwe vaita se nyangwe vakura.
Ndiwo wanga utori mubvunzo wangu unotevera iwo varusike kuti most people might say chirwere chevana but dai mambopadzokora futi zvakare. Are you saying that an adult can also contract measles?
Yes, so those who have not had measles before and have never been vaccinated can also get measles. Even vari vanhu vakuru vanokwanisa kuibatawo zvekare. Asi zvinoonekwa kuti vane njodzi yakanyanya yekubata measles vana vane makore ari pasi pe5 years ndivo vanonzi vari at the highest risk yekubata measles kana kusvika